choose, and I'll take the rest.
Thank you. Thank you very much for the opportunity. Honorable Minister, Honorable DM, Honorable MSC, members of the media. The road accident fund question, is it because the lawyers were emboldened because of the failure of the prosecution? As you may be aware, that we do have a specific proclamation under which an intensive investigation is happening at the Road Accident Fund. And there are findings already there that we have really gone public on. I think even when we presented to the to SCOPA in Parliament, a number of attorneys there, a similar phenomenon that we are seeing here, that when we made findings against them around, fraudulent claims and so on, they came forward, and paid back, the monies. But over and above paying back the monies, we have also, as in this case, referred them to the Legal Practice Council and to the National Prosecuting Authority. So as you know, that once we refer evidence to NPA, they also have a duty to go through, the evidence, and of course satisfy themselves that they can make a decision either way, whether to prosecute or not to prosecute. But that's also on their part, a process that they follow. Right. The issue around I'll just go straight to the issue around the head of department at the Department of Health, whether he's under investigation or not. This question came up yesterday evening at the memorial service of Babita Diokran, and my response was, I will need to verify with the Gauteng head or Gauteng investigating team, because more often, these referrals are made to the investigating teams and so on. We did not have the actual response, and we did not want to mislead the public then. Overnight, we could not get that verification, so we will still verify. And of course, you can come back to us where we can give you, a response. And of course, we will also inform the ministry and the MEC, because now it has come out public. We'll really inform them whether it's factual that is under investigation or not.
What took longer to charge others?
Yes,
Other than Nungu?
that's right. I think the response there is that, as you can see, the investigation is really quite complex. I think the issue around Nonguba, the reason why we are able to mention is because we started way back in the Eastern Cape, right? And perhaps the details of that is even before the proclamation was signed in 2022, we had already started investigation together with the Department of Health at the time, right? And how did it happen? As a question may come up, that why do you investigate without a proclamation? More often, the public really sees investigations that we conduct under proclamation. But there is a provision in our legislation which says we are able to second the SIU officials to state departments to start these preliminary investigations, which will allow us to gather information to then draft a proclamation. So this is how it happened. So at that time already, when we were, had seconded our officials to the Department of Health in the Eastern Cape, we already uncovered the activities of Nonguba. And then we were able to, because they are quite magnitude as well. It's not a small amount of claims. We took a while, but we were able to finalize them with the department and then deal with him at that time. So the others came, once the proclamation came up. So the Lenguba one we were able to process, and you can realize that these actually have footprints in other provinces. So when we analyzed his claims, we looked at other provinces as well. It's quite magnitude. So we already started the Legal Practice Council with him, and matters are already in the High Court, in the Western Cape as well, where we really would like the courts to ultimately strike the firm, Non-Nguba Attorneys Incorporation, of the practice role, and of course the criminal charges have followed. They've already appeared in court, and other professional misconducts. Thank you, Minister.
Thanks a lot, Advocate. Junior, your first question is whether lawyers won't get involved and whether it's not the cause of the problem to withdraw. But let's look at practicalities and be pragmatic. In Gauteng alone, as I've said, the claims are 2,450. The SIU is busy with 611. They've only completed 58. They are investigating in RAF, in Tembisa, and many other places. It's a lot of work. They will arrive there, but the question is, after how long? Now, we are extending a hand of friendship for lawyers to change their mind. Let them be visited by their God or the angel Gabriel to warn them against the immorality of what they are doing. And we are saying when they do so, they will withdraw. There will be a withdrawal. I gave you an example of this 70 billion rand in Limpopo. All we did was to ask the attorney to, after Professor Mugwena made this finding, he said, no, bring your patient to be examined by our own professors. They immediately withdrew. I was very unhappy, I must tell you, but I realized later one got to be pragmatic. I was fighting with the police. They said, no, this guy is withdrawn. I said, no, he must still be charged. In the same week, there was a claim for cerebral palsy that never happened in Donald Fraser Hospital in Limpopo. And we brought the patient here to be examined by Professor Smart, who is the professor of pediatric neurosurgery at Steve Biko. And she found no cerebral palsy, and they immediately withdrew. We left them. We can still charge them, but as I'm saying, there's a lot of work, and we are just saying come and withdraw. And as it has already happened in the Eastern Cape, by the way, lots of them will withdraw just by hearing that NPA is there. Now we are asking you to spread the message. Lawyer, please. Yeah. Did I say? NPA. Oh, sorry. Even yesterday I kept on saying NPA. I don't know what's wrong with me. So we are asking you to help us with your media channels. Lawyer, please. The game is over. Come and withdraw, and nothing will happen to you. But if you don't withdraw, certainly something is going to happen, because they will still reach you. Rodi Sang, the issue of state attorneys doing out of court settlement is part of the investigation that are ongoing. Is there anyone? It's possible that they might have done out of court settlement innocently or out of not understanding, but then the question will still arise. Why you do that without a client? Remember, we as department are clients of the state attorney. Just like you become a client of any other lawyer who will represent you. You won't be happy if that lawyer makes an out-of-court settlement and you knew nothing about it. Lawyers must work on the basis of instruction by clients. And so the NPA, the SIU rather, will help us in that regard. Which hospitals were mostly targeted? Without checking, I'll say in Gauteng is Chris Hani Baragwanath Hospital. And I've seen ENCA has got somebody placed there at Chris Hani Baragwanath Hospital, and on the bottom there, it was written negligence. I don't want to defend Chris Hani Baragwanath Hospital. It's to be expected that in Gauteng they will be the topmost. For the simple reason that Chris Hani Baragwanath Hospital is huge. I've said it before, that we're not supposed to have allowed such a hospital to exist. And we're still having plans to cut it down into components, because according to standards from the World Health Organization, no hospital must have more than 1,200 beds. If you do that, you won't be able to manage it. And that's what's happening at Chris Hani Baragwanath Hospital. The last time I counted, I don't know MEC, it was 2,800 beds.
It's 888 now.
888. What happened to the rest?
2,800.
Yeah, 2,000. I was going to be surprised. The last time I checked, it was 2,800. So you see, it's 2,888. And a normal hospital must be 1,200. If the hospital goes beyond that, it starts having problems. That's what Chris Hani Baragwanath Hospital is. Remember that it was built for Soweto, which is huge, the biggest township in the country. And they kept on extending it. But now the time has arrived that Gauteng, you remember they did build other hospitals like Bekimlangeni to try and relieve Bara. But the size and the rate at which Soweto is growing and other settlements around is just not enough. So for that reason, you will definitely find this type of problems. It's simply on the basis of sheer numbers than anything else. The Aviwa, you are asking me about 2015, 2016, whether I was aware as a minister then. I thought I've informed you that in 2016 we called a medico-legal summit because of this awareness of the explosion. The reason that we called a medico-legal summit because we were sitting there and see escalation of claims, and we said something is happening here. And then we also learned that the private sector, that's why they were in the summit. Here the NPA, the SIU, oh my God. The SIU is not investigating private, but let me tell you what's happening. I promise you, now you remind me. The most targeted people are obstetricians and gynecologists, because pregnancy and childbirth can have complications, as you can see, cerebral palsy. So those colleagues who are in private practice, who are specializing in obstetrics and gynecology, are the most targeted, followed by neurosurgeon and spinal surgeon, because operating somebody on the brain and spine, you may not get 100% results. Then they are targeted so much that in private practice now, the Medical Protection Society, the society where doctors must go to buy indemnity, because you have to buy indemnity by force. Those who do not understand, like when you buy a new car, you have got to insure it, otherwise the bank won't agree to finance you. So here, when you start a medical practice, you have got to pay indemnity. That's insurance in case they sue you. Now, to be an obstetrician and a gynecologist in South Africa today, before you open your practice, you must put 1.3 million on the table for indemnity. Imagine, yes. They must buy indemnity for 1.3 million even before they open the practice, which means you must be rich already before you open that practice. Where are you going to get the money from? And so what's happening in South Africa now is that many obstetricians and gynecologists no longer practice obstetrics. You'll be aware that gynecology are diseases of women. Obstetrics specifically means pregnancy and childbirth. We have women who come and say, look, I've been going through, to this doctor for ages, but now I'm pregnant, he can no longer want to see me. Because he's scared of being litigated on. Which means what? Women are very soon no longer going to find gynecologists. So the results of this thing is manifold, as I might put it. Now, it has also resulted in doctors doing what we call defensive medicine, where when you got into the rooms of a doctor, he doesn't look at you sympathetically as a patient. He looks at you as a potential litigant, that you are going there to come and litigate against him if you made a mistake, what then will doctors do in defensive medicine? There are other investigations that are not necessary to cover themselves. He will do an x-ray and say, yeah, I found what I wanted to see. But then you'll say, oh my God, what if this person goes to court and the lawyers ask me why I didn't do a scan? What am I going to say? Then you'll say, medically, I can see a scan is not necessary, it's not indicated. But why not do it? It's the patient who's going to pay anyway. So they will do the scan and look at it again and say, what if they say I should have done an MIR, magnetic resonance imaging? I don't need it. But if they ask me in court, why not do it? It's not me who's paying. The patient is going to pay anyway. So you keep on ordering. This is what is happening in America, which has ratcheted the cost of healthcare in America. South Africa is right on the footsteps of America, to an extent where the former Director General of the World Organization asked me a question in Geneva when we were there for the World Medical Assembly. He said, Minister, tell me, in South Africa your healthcare system is British. You are running a British system, which is true. Our curriculum is British. Our degrees are British. Because they were our colonizers. Even up to today, our nurses training is British. She said, everything you do in healthcare is British. But when it comes to healthcare financing, you go American. Which is the system of healthcare financing we are following, which is American. The British system, as you know, they are following the NHS, which in South Africa we call the NHI, which all of you in front of me are fighting ferocious. But that's what the British system is doing, and it's saving the money. But in South Africa, we followed an American system. Because of this American system, let me give you figures. 43% of all the money that is spent in healthcare in the world is in one country, it's in America. All other countries of the world remain with sharing among themselves the remaining 57% of the total world healthcare expenditure. That's America, and yet we are moving in their footsteps and doing everything that the Americans were doing. That's why Dr. Chan asked me, at what stage did your country deviate from the British model and follow the American model? She even said the American model is the worst that America ever bequeathed to the world. That's why Barack Obama tried to change it with what is called Obamacare. The name Obamacare is a nickname, but it was masking the actual aims of Obama. The actual full name is affordable health care. He said America must start now going for affordable health care because what they are doing is not sustainable, which is also, of course, not sustainable in South Africa. So we became aware of this, and we were worried, as we are saying in private practice. There is a professor who told me, he didn't hide it. He was a professor, I'm not going to name the hospital, but he also had his private practice. He then said, Minister, in my private practice, I don't want to see any pregnant women. I refer them to the hospital where I'm a professor, so that they can sue the state. In my practice, I'll only see gynae, because there are not many litigations against gynae. So the whole practice of medicine is changing in form and content because of this type of behavior. Action against employers, yes. Any employer who is found to be part of this collusion, the SIU will charge, will send to NPA. Like we have told you about nurses who steal records. I have seen in some of the reports, especially Auditor General, where she's blaming provinces for not keeping proper records. I may not stand against that and say they are proper records, but I can assure you most of them are stolen, as we have already said here. And the only thing that will help us if we have got electronic records, which we are working around the clock to have them. But it is health workers who are also helping. Look, there's financial incentive here. If a lawyer knows that he's claiming 35 million or 18 million, which I said the lawyer received in Eastern Cape, in Northern Cape, and they offer a nurse just 1 million or even 250,000 just to steal a file, They will do it, unfortunately. Because wherever there is money, there is evil. Whether, Avia, you also asked whether we'll recover money. But I thought I've explained it, you might not have picked it up. I said the legal practice provident fidelity fund, rather, legal practice fidelity fund, LPFF, was established specifically to reimburse patients who might have been cheated by lawyers. Because by that time, the lawyer might have charged the money. He has got nothing, you can take him to jail and arrest him and strike him off the roll. But what is the poor patient going to get? So that fund was established to reimburse them. And as I've already said here when I was reading, some of them have already been reimbursed by such a fund. But then the lawyer must go and answer in court through the NPA and to their legal professions council. Yeah, I think we've answered all the questions. Thank you.
That is it. We